What I'm going to do is to say a little bit about the structures and layers of EMTReK, and then to give you a sense of how we've learned in using EMTReK to disseminate a model of knowledge transfer, the intricacies of this process. I sometimes find it's very meta to be talking about using a knowledge transfer model to inform the dissemination of a knowledge transfer model, but this is something that we've actually thought a lot about over the course of the project. So as you saw before the break, EMTReK is an evidence-based model based on a rigorous systematic review of the research literature in health services broadly, but looking at what the core components of effective knowledge transfer and exchange may be when we're considering research knowledge. And I'm going to take each of these elements and tell you a little bit about them. So as you can see, 6 core components ranging from these very interactive elements of message, stakeholder and process, but recognizing that those things occur within a local context, the organization you may be working in, and that these all sit within a social, cultural and economic context. And as George mentioned, those hands at the bottom representing the essential role of constant evaluation of this activity so that we're aware of how it's impacting. So in terms of the elements, and it is quite difficult to start this model anywhere other than the message, but we do always highlight that those 3 elements interact. So in our work, we identified 5 what we call operational elements in the context of the message. And this reflects, I suppose, what we feel we've done differently is that moving beyond the core components, we tried to guide researchers as to, well, what are the things you can do or think about specifically, the operations that you can consider when you're actually planning this activity. And I'm going to start at the top with the idea of it being needs driven, but again, these interact very much. So when you're identifying that message, the idea of a message that fills a need being more audible, being more hearable, more receivable, really reflects that people, when they're surrounded by multiple messages from multiple challenges, the ones that can stand out are the ones that answer a need, that actually do something for us. When we're sorting through all of those messages, the ones that will catch our attention will be the ones that can help us. So for example, if you're driving on your journey and you're listening to the radio, what you may pay more attention to is an announcement about a traffic problem on the road you're on. It might be talking about the M9 or the M1, but you hear M7 and it catches your attention because it's directly related to your journey. So good messages are needs driven. They answer a problem. And in research dissemination, those messages can be very varied. And I often use the example of recruiting participants. So those of you in the room who've done research, I'm sure you face the challenge of recruiting people for your studies. One of the most important messages you can disseminate at the beginning of a project is, what is my study about and why should you take part? And disseminating that message meets a need that you have as a researcher for a reliable, credible sample. So different messages will meet different needs and your project will have multiple messages. And the other element that I've highlighted here is that multiple types of message are valid. And what we mean there is recognizing that there are different types of research. There's qualitative, there's quantitative, there's public health, there's epidemiology, there's small-scale case studies. So this model recognizes that different types of research are valid as long as there's a credibility to them. So your message has to have an underlying credibility, a trustworthiness. So for example, when we talk about EMTReK, we focus on its evidence base. It's been developed from a systematic, rigorous review of the literature. That enhances its credibility. George and I didn't just sit down and come up with a set of components. We analysed the data systematically. So there's that idea of credible message. So why should you pay attention to EMTReK? Because it's based on a rigorous process. Another element of the message is accessibility, and Mary and Marie have mentioned the NALA guidelines that are available today. It's one of the areas where researchers can struggle because we are very good at technical language, we are very good at high-level interpretation, but we're often not very good at accessibility beyond our peers. So whether it be different types of stakeholders, whether it be policymakers or the public, Mary's reference to a stepped wedge design is a perfect example of something that will be meaningful to a researcher but may not be meaningful to other people in the room. So this is that other operational element. Have you considered the accessibility of your message? Now, it's not necessarily saying that all messages are communicated in the same way, and that's where we'll talk about stakeholders and linking into that. And then finally, actionable messages. Messages you can do something about can be heard more effectively. Again, you're on the M7, you hear that notice about the possible delays ahead of you, and it says, if you want to avoid this, exit at exit 25. And you can do something about that. That message is going to land much more effectively. In the same way that if you're recruiting your participants and you say, again, in that accessible, clearly disseminated message, to take part in the research, click this link, contact this person, go to this website. There is an action that comes from it. So again, EMTReK recognises the message in a way that most other models do. But what other models don't necessarily do is drill down to say, these are those operations. What can I do about this? Moving on to the stakeholders, again, one of the things that we identified in the literature was that almost all of the papers talked about different types of people and different types of audiences. And we've used the term stakeholders to represent the very active role that they play. The word audience is very passive, whereas stakeholders, we want them to hear, but we also want them to do. We want them to act. And again, there's a huge recognition, as you can see, that good knowledge transfer and exchange involves multiple stakeholders. But we identified three particular groups: the producers of knowledge, the researchers, talking to other researchers, again, something we're very comfortable with doing, but oftentimes we might miss that there's a message within our research for other researchers. So maybe you've learned lessons about engaging with people at the end of life and the intricacies of doing that research that would be very beneficial to other researchers. It might not be the main message of your study. Your main study may be about the patient experience, but you have a valuable message for other researchers about how to access these views, and that will need to be communicated to other knowledge producers. Something we get asked a lot about is why we distinguish between knowledge users and knowledge beneficiaries. And what we wanted to recognise here were the layers again. To us, the knowledge users are those practitioners, managers, organisations, developers of services who may make decisions around the way they deliver their services based on your research. Whereas the knowledge beneficiaries for us are the patients, families, communities that may benefit from those changes in service, changes in practice that your research will inform. So recognising that there are multiple stakeholders, again, EMTReK encourages researchers to think about these other groups and how they may interact. And one of the key messages that we'll often share is there will be different messages for different audiences, for different stakeholders. And oftentimes that's where you end up spending a lot of time brainstorming with your research. Who am I to speak to and what do I have to say to them? Okay? Then the process, the other part of that trio of components at the centre of the model. And what was interesting again was multiple papers talked about the process. What was interesting is when you get down into these operational components that we isolated, the frequency of these components was much, much lower, because while a lot of papers talked about the process being important, they didn't tell us what the process involved. So these are the sort of 6 core operations, again, those working pieces that we identified. So first of all, it is an interactive exchange. Like all communication, it's about the production and the reception of the message. So it's an interactive process. And you have to think about, if you're going to share your message, how can you hear back from the people that you're sharing that message from? So George this morning, again, showing good practice, asked you for your view on that analogy of the journey. How did that land for you? How did that work for you? Because if that was something that you didn't identify with, it wouldn't work as part of the message. The skilled facilitation, you will have seen that that was part of the Paris model, and if you're familiar with Paris, it does talk about facilitation, but what the literature recognised was that knowledge transfer and exchange is not a natural skill that everyone has, and it needs both a skill background, like an ability in this area. But the facilitation word is important because it's about supporting and encouraging. It's not top down, it's again very interactive, but it's about developing those skills. And again, you're here today because you are interested in honing, developing building the skills that you have. The third operational element there, the targeted and timely activities, really echoes a number of the messages you've heard already today, that it is about when do you start this? Is it the end? Is it the beginning? And we would always say, again, different messages for different audiences at different phases of the process. And when you're thinking about the messages in the audience, you have to think about how to target those activities. So if your message is about recruitment, it's going to come early on. If your message is about your findings, it will evolve over the course of the study. If your message is about reassuring your funders and other stakeholders about where the project is at, that will happen all the way along. So it's an ongoing process of multiple activity, but again, targeted and timely. And again, you'll see from the survey, the Mentimeter survey that we use, that again, it's about diverse activities. And as a researcher in an academic institution, my president is very keen for me to be producing peer-reviewed publications, to be attending professional, international conferences. But interestingly, there's a growing interest in my activities around much more social impact, whether it be the rise of altmetrics, this idea of using social media to track how much chatter and talk is there about research, how much discussion is there of papers, how much awareness is there of issues. Diverse activities really does recognise that idea that you won't have a single channel of dissemination anymore. You will have multiple channels. And the more that we can make use of media that is more accessible, the more likely the wider public are going to hear about your research. But again, think about that interaction. If you're disseminating on Twitter and you're not thinking about the accessibility of your message, is your message going to fall on deaf ears? Or is it only going to fall on the lap of people who are interested in research? Can you think of a short, snappy message that is accessible to the wider group and may make different people aware of your work? So it's that diversity. The next component is one that I personally have learned huge amounts about. And it is that idea that knowledge isn't just passed, it is marketed. I don't like saying it's sold because it sounds a little bit proprietary, but it's about really, really actively sharing that information, marketing. Why should you listen to this message? Why is it important? And anybody who's linked in with Marie, whose background is in marketing, will know that it's not a natural way that researchers think. But actually, if you can crack it, if you can begin to think about that idea of how do I get my message in the midst of 100 messages through? And, you know, given the time of year, it's Christmas, we're surrounded by advertisements for Christmas presents and shopping. It is amazing how children can hear something on the TV from another room about a particular toy they like when they won't hear you asking them to pick up things off the floor. And we know that marketing of toys to children is probably an evil skill. But it's getting us to think about this active marketing, this active engagement. And then the final piece, again, is something that I think we've been very aware of, is that idea that opinion leaders can be very influential in terms of helping with that process of getting your message out there. Anybody who's had the experience of either a celebrity or a minister or a dignitary or a well-known member of the community taking up your research, mentioning your research, discussing your research, will know that it can have huge implications for how it's heard. But there are different types of opinion leaders. The Institute is positioned to be an opinion leader. Milford is positioned to be an opinion leader because they're at the centre of this network. They are listened to, they are recognised for their knowledge in the area, for their leadership. And working with opinion leaders can be very effective. So, for example, the Institute coordinates Palliative Care Awareness Week in September each year. And a number of researchers involved with the Institute have begun to recognise that that's a very good time, so timely and targeted period to be sharing information about their research and to be working with the Institute to share that research. So again, getting you thinking not about the idea of the process, but trying to guide you as to how this process might operate. The last component of the model that has these operational elements is the local context. The wider social, cultural and economic context and the issue of evaluation are very broad concepts or components within the model, and there wasn't much information within the literature that broke that down for us. But when we looked at this idea of the local context, there was some guidance around what, again, are the operational elements. And the one there that just happens to be at the top, organisational influence. The organisation within which you work, the organisation within which you may be sharing your research, will have an influence on the way in which your knowledge is likely to be disseminated, to be transferred. So, for example, have they supported the research? Are they helping you with the dissemination? Are they guiding you around who are the stakeholders who may need to hear these different messages? Are they assisting you with that accessibility issue? Are they guiding you around that? And organisation influence links very strongly with organisational culture. And is the organisation a research-aware organisation? Does it have a culture of encouraging research to inform practice? Does it have a culture of encouraging staff to disseminate their research beyond the organisation? Again, I work with different disability and health services organisations, and some are really keen to support staff to share their knowledge beyond the organisation. Others are more cautious and they're much more comfortable with it being internal, with it being evaluation, with it being audit. So what's the organisational culture within your setting, and how might that influence? And how might you leverage the organisational culture to be more effective in your dissemination? Can you benefit from the willingness of the organisation to share learning with other organisations, to share learning at a higher level? The readiness for knowledge, again, links very much into that, but it's slightly different angle. It is that idea of, if you want your research to create change within your organisation or another organisation, is that organisation ready to hear that knowledge? Is it in a position to take on board the messages that you have from your research and to learn lessons and to respond and to react to it? And we know that organisational readiness in general is a very complex phenomena, but readiness for knowledge is something that you may have to try and assess. So when you've identified the organisations within which you're working or within which you want your research to be heard, how ready are they to hear that knowledge? Can you again take advantage of, say, there's a massive change initiative within the organisation, and that's the fertile soil for your knowledge? That's the time. Is there a change of leadership within the organisation, and an outgoing member of staff would have been a brilliant opinion leader, would have been a brilliant champion, but now you're going to have to wait while a new person settles in? So being aware of the readiness for knowledge within the organisation is key. And then George has mentioned resources, and in some way it's the easiest operational element to talk about, because knowledge transfer and exchange does require resources, but not just financial resources, but human resources. It requires enthusiasm, it requires energy, it requires commitment. Again, for those of you who've been involved in an ongoing research project, they are very demanding. Keeping track of your recruitment, your data collection, your ethics is a significant amount of work. When you layer alongside that an active, targeted, timely, diverse knowledge transfer plan, it is another layer of work, and you need the resources within your team to really effectively do that. But also you need to be very smart at identifying the resources that are available around you, the resources that actually you have access to, whether it be through your organisation, through groups like the Institute, through professional bodies, that there are resources for KTE out there that you can draw on. So they're the four components of the model that have those sub-components, those operational elements. And again, as George mentioned, there is nothing unique and new within this model, because these things have all come from that analysis of the literature. But what we hope and what we feel very strongly is that by bringing them together and by structuring these operational elements to help guide your thinking and your decision making, that actually this can, light a few fires. This can give you a bit of guidance where you may be unsure. In terms of using EMTReK as a model, as the work that we did with and for the Institute was about getting to a point where we had this structure, but then trying to learn lessons about what it's like to use it. Now, Siobhan will give you some insights into the experience of doing that. But I suppose what's interesting for us is that we wanted a model that would guide the process, that would describe the things you need to think about as a guide for researchers. And we wanted to be able to inform practice. Now, by practice, I mean dissemination practice, as well as future research. And what we were really interested was the relevance and suitability of this model in palliative care. So again, the model was based on broad health services research, and we were unsure about its relevance to palliative care. So we conducted a series of case studies that would help us to understand that. And we were the first case study, which again is an interesting experience. When we were planning our dissemination activity, we were getting these early messages from the analysis, and we began to buy into those messages. So some of you may have been present at the first PCRN symposium that we presented the model at, which we used as very much a working opportunity to give an initial summary of the model to an audience of interested researchers and practitioners and users of services, and to hear back from them about our language. And we tweaked the model after that workshop. But all the way along, we have been committed to this idea of active dissemination, targeted and timely. So we do have the publications. One of the first publications we did was a protocol for our review. So before the review had been conducted, we published the protocol so that we were getting feedback on it. We have also published the paper, and from the very beginning in our budget, we had a budget for open access for the paper, because we knew that for good knowledge transfer, we had to have an accessible piece. But that's not enough. The work that we've been able to do with the Institute, and the huge support we've had from the Institute, has been about making this real. Now, obviously, the Institute recognised the importance of this from the beginning by funding the research, but they have continued to work with us. We've learned from them, they've learned from us, I hope, in terms of how EMTReK can be real and influencing. These workshops are an example of that diversity. We've promoted the use of the model. Even the time that we took to come up with the name EMTReK. Myself and Lucia Prahovdova, who was a researcher on the project with us, spent a good hour and a half playing with the words of the title of the project. It was T-Rex for a little while, which I was very excited about, except T-Rex is spelled with an X, not a K. And we came to this word EMTReK, and we was like, okay, it's got a ring to it. No one else knew what it was. We even had to convince George. But now, EMTReK is actually something that other people know about. So the thought of the name, the social media identity, how that was going to do, is all part of us trying to live the model through our own work. And again, making the support of the Institute to make all the information on the project available on the Palliative Hub, obviously directly through the hub, but also using the shortcut knowledgetransfer.ie. Again, we're focusing on that accessibility. So we were a case study of understanding how knowledge transfer would work with this model and whether it was suitable. But we did explore further case studies, and we conducted this as the final component of our overarching project. And as you can see, there's some information on the study. It was looking at EMTReK within a palliative care setting and exploring the process of using this model. What was it like for researchers to explore it? So both George and I were interviewed as part of these case studies, which was an interesting reflective process to have the time to have someone asking us questions about how and why we did this. But we also spoke to 4 other research teams about their experiences of using the model. And I'm just going to summarise a few of the findings for you. This paper is under review at the moment, and we're hoping that once it's in press that we'll be able to add it to the list of resources that are there. But what was interesting was when we spoke to researchers using this model, there were 3 groups of findings that were particularly interesting. The first was in terms of their assessment of the model, what was important to them about the model. Given that credibility is one of the components of EMTReK, the credibility of the model was a key factor in people's comfort and confidence in using the model, that it was based on a systematic literature review, that it was being prepared for peer-reviewed publication, that we had disseminated it and heard back from stakeholders about it. And again, not surprising, the accessibility of the model was a key theme that emerged as well from researchers, that this was something that they could access that was relevant to them. And we were very relieved, I suppose, to get feedback that researchers felt that it was applicable to palliative care, that there were no elements of the model that didn't work in a palliative care context. In terms of their experience of actually implementing the model, how did that work for them? The timing was the key thing. Multiple participants raised the issue of I came to this at the end and I really should have been doing this from the beginning, which again is great for us to hear, but it is really reflective of that idea of starting from the beginning. And in fact, a number of our case study participants have gone on to use the model. The other element that they were very positive about was we were working with an excellent postdoc, Mary Jane Brown, and one of Mary Jane's roles was to sit with the researcher, to discuss, to reflect, to challenge, to question, to suggest. And that process of facilitation was really, really highly valued by the researchers. And also as part of our case study, we did provide, we had within our funding some small amounts to provide the case study teams with some funding to do some interesting dissemination. So one team put their information on a USB key and made that available electronically to people. Others used it to organise an event. And then in terms of outcomes, we were interested in their perception of what they felt using EMTReK had done for them. And the two key themes which we identified were, one, they did feel that it enhanced the quality of the research by having them think more actively about this. But they did also identify some limitations and areas for future consideration, including things like skill development, including continuing resources available. Just to make that a little real for you, these are some quotes from the case studies about using EMTReK. First one highlights that there are other models out there, but this researcher felt that this was something that she could specifically consider for palliative care. And again, noting that cultural context of palliative care research, that she felt this was a difficult area to research and it's underfunded, and that the model can help with that process. Again, applied. And the second quote there, really recognising that facilitation role. And it's not that we would suggest that that facilitation always has to be from outside, but as teams become more aware of knowledge transfer, as teams are exposed to things like this workshop and other resources, that skill begins to develop within the team. So they were the key findings just in terms of our learning around using EMTReK, those operational elements within the core components. And I think definitely answering some useful questions for us in terms of how it worked for researchers in palliative care, leaving us with more questions. We're very aware, George and I, that this is a model that needs to be evaluated. So how do we evaluate that process? How do we learn lessons about EMTReK in a wider context, in an active context? And we're hoping to continue to do this work. But just to finish by thanking everybody who's been involved in the research component, and also to the Institute and the other funders for supporting that work. And hopefully we've got some time for questions. Thank you.